So now let's see what is glomerular hemodynamics. That is, what happens when the afferent arteriole and the efferent arteriole constricts and dilates. This is the afferent arteriole, this is the efferent arteriole, this is the glomerulus. So when afferent arteriole constricts, the GFR will decrease and the renal blood flow also decrease. When the afferent arteriole dilates, there is more blood flow, so GFR will increase and the renal blood flow also increases. When the efferent arteriole constricts, what happens is just the opposite of what happened when afferent arteriole constricts. That is, the GFR was decreasing, so here the GFR will increase. And what happens to the renal blood flow? We know that the normal blood flow is from the efferent arteriole to the peritubular capillary to the vasa recta and to the renal medulla. So when the efferent arteriole will constrict, then the renal blood flow also decreases. When efferent arteriole dilates, the GFR will decrease, but the renal blood flow is increased. Now, what is causing this dilation of the afferent arteriole? That is prostaglandins. Prostaglandin cause dilation of afferent arteriole. What causes the constriction of efferent arteriole? Angiotensin 2. What is decreasing the angiotensin 2? ACE inhibitors. So when the ACE inhibitors are given, we can dilate the efferent arteriole. So question arises that why NSAIDs are contraindicated in patients who are taking ACE inhibitors. We know NSAIDs will block prostaglandin. So what happens? The afferent arteriole cannot dilate, so it will constrict. This will cause decrease in GFR. When the GFR is decreasing in normal patient who are not taking ACE inhibitors, the efferent arteriole tries to compensate by constricting and thus increasing the GFR. So the GFR is maintained. But when a patient is on ACE inhibitor, this ACE inhibitor will block this constriction of efferent arteriole. So now the efferent arteriole dilate, and when the efferent arteriole dilate, the GFR is low in spite of the fact that the afferent arteriole is constricting and the GFR is less. The efferent arteriole cannot constrict because of the ACE inhibitor, which is blocking the angiotensin and thus causing dilation of the efferent arteriole, and the GFR is low. This leads to renal failure.